I think that we figured out something. I just want to confirm is that it felt like we needed to put the knee further into, like we were
to the sacrum.
Yeah, because when I thought of piriformis, I would put the knee closer to the piriformis, but I need to get actually to the connection, not into, yeah.
Anywhere along this, it's golden.
But it
Knee
probably
position.
depends on the person and how tight they are in one
And some
area.
people, it's going to be real close to the sacrum.
Depending
And some
on how
people,
tight
it'll
they
be a
are.
little more like lateral.
Right.
Will you do it on this side, just so I can see what kind of pressure you're pulling?
And in my case, what I've noticed is just from, they were asking, I have a tendency to, when I'm facing the person and their head is here, I'm using the knee that's closest to the head.
Okay.
That's just what I noticed. I'm not saying you couldn't use the other leg. It's just, it seems to be what I wind up doing. So I'll come in and
I kind of always think on terms of medial, just to take pressure off the
Yeah.
knee.
I'll bring her up. And I'm going to stack her high at first because this is very different pressure. How's that? Okay, I think this is going to work a little better for me. How's that?
Good.
Okay. Then if I drop down a little bit, do you want more medial? In other words, with my knee further over?
Yeah, closer to the
Okay.
sacrum is
We'll-
good.
we'll
On
try
the
it just to
medius.
see.
Yeah, it's close to max.
Right there?
Yeah.
A little closer, almost on the sacrum there, right?
Yeah.
Big broad. I mean, basically, I've lifted her whole body off the table. Now, here's the difference. That's stacked high. This is more pointy.
Okay, and this is the one where you
This is more like pigeon. I'm gonna make sure
Yeah.
hand there.
Good.
And then how's that right there?
Yeah.
Do you want my knee a bit higher? Like up towards the head?
No, I don't think so. I think higher will actually make it almost not feel,
Right there is good?
yeah.
Now, we pulled her pelvis up. She's off the table. Her body weight's just sinking right down on my knee, right there. What about a jostle?
That feels really good.
And that's where I ask her for, because it's not right or wrong. It's just,
Whatever
what does she
feels
like?
good.
Yeah.
Yeah.
There?
Yeah.
More up that way?
Yeah.
There we go. She likes that. How's
good,
this?
yeah.
Oh, that made me slide a little bit. Hold on. I changed it. There we go. Right there, still good? What about right there?
Yeah. Up higher does.
There? And I did that not to straighten your leg, but to apply a
feels
little more
better,
pressure.
actually,
Right
yeah.
there?
That gives me an idea as to how much you can kind of like go with it. Yeah.
Jostle. Now when I
Yeah.
take her off, just like that.
Yeah.
I just need to make sure in my case, I don't want you to jeopardize your knee at all. If it feels uncomfortable, let's say for some reason you have a hip and it just doesn't turn. It's like, it doesn't allow this. Like your hip, like no, it just doesn't work. Tennis ball.
Okay.
Same basic idea. Now, could I also do this? Lay back down for me real quick. Could I do this with a fist?
Oh, yeah. That's how
I
do,
could, but
psoas, face
but
down.
it'll be more pressure.
Yeah.
It's also a little sharper. How's
Yeah.
that?
That's good.
It's something, but it's also putting pressure on my hands and joints where it's like compressing. I prefer the knee, but let's say none of that worked. You're like, I don't like it. Okay. Turn them on their front, do the compression from the other side, either with the knee, the forearm, the elbow.
Okay.
Yeah.